What are the key characteristics of family systems? How do family system assessment instruments help social work practitioners? Today, we will talk about clinical assessment of family systems. Understanding and assessing family requires a systems perspective. And this systems perspective emphasizes that the collective family unit operates with distinct patterns and functionalities that transcend individual behaviors. This video examines various methods to evaluate families involving standardized measures, interviews, and observational techniques, plus graphical and problem-oriented approaches. Different theoretical lenses, from classical structural and strategic models to contemporary strength-based frameworks like narrative and feminist models, offer various insights into family dynamics. Family structure can be understood as a unique way in which members of the family form interactional patterns. Family constellation is another aspect of the family structure. These are things like single-parent household or an intact family. Navigating the intricacies of family systems requires a good understanding of relationship and communication dynamics. The balance in dyadic relationships sways back and forth between the harmonious, complementary, and potentially tumultuous, symmetrical patterns. Triadic relationships introduce the concept of triangulation, a mechanism for stress regulation, which can both stabilize familial interactions and lead to family dysfunctioning. There are different types of communication, such as verbal, or words that we use, nonverbal, our body language, and meta-communication, which refers to the tone of voice and timing. They are very important for understanding family functioning. Communication needs to be open, direct, and clear. Also, there has to be congruence between what family members say to each other and how they do it. Family dynamics are shaped by embedded rules and myths, creating a distinct ecosystem of interactions and perceptions. Rules, whether transparent or concealed, lay the foundation for expected behaviors and interactional norms among family members. On the other hand, myths, which are collective beliefs, often detached from reality, conjure shared narratives that influence the family's view and treatment of its members. Both elements often interact with each other and create relational expectations regarding each member of the family. Functional families navigate through problems, decisions, and daily life with structured conversations and agreed upon rules. Whether it's deciding who does the laundry or how to solve an issue, efficient problem solving, clear negotiation, and fair decision making are crucial. These elements not only shape everyday interactions, but also manage conflicts and build supportive environments. For social workers, understanding these dynamics helps to create interventions that guide family toward healthier interactions and improved communication, making sure that every member feels heard, valued, and understood. Addressing family challenges isn't just about observing behaviors, but also digging into deeper often unseen factors like genetics and mental health. This means looking at how individual health issues, which might be inherited, impact the family's overall dynamic and well-being. Therefore, social workers should not only focus on external interactions, but also work closely with uh, medical professionals. Working together, they can better understand, diagnose, and create solid plans that tackle issues from all angles so that every family member gets the right support and the family as a whole can move forward with more harmony. Focusing on what's strong, not just what's wrong, is fundamental in family therapy. A strengths perspective brings to light not only the innate resilience and coping mechanisms found within individuals, but also identifies the external protective factors that fortify a family, like supportive relationships and safe environments. This lens doesn't ignore problems, but sees clients as more than their challenges, recognizing their inherent worth, potential, and the positive, often untapped resources they possess. Therapists using this approach often believe in the transformative power of individuals and relationships. Acknowledging the profound influence of ethnicity, culture, and gender on individuals' experiences, expectations, and perspectives is crucial, both and in the assessment and in the therapeutic context. These elements often shape clients' worldview and, in some cases, impose perceived and real limitations. For instance, experiences like racial discrimination may narrow life's perceived possibilities and lead to specific emotional or psychological responses. An accurate understanding of a client involves investigating these multifaceted experiences so that we can show respect for their unique cultural and personal context. For this purpose, clinicians use tools like cultural formulation interview or CFI. Additionally, we should use an open, explorative, and non-judgmental communication approach. The all-sensor complex model provides a structured approach to understanding and navigating the complex dynamics within family systems. It examines three dimensions: cohesion, flexibility, and communication, and allows professionals to gain insight into the family's emotional bonding, ability to adapt and communicate. Phases 4 is an instrument that allows to see these dynamics. It is a versatile tool applicable in diverse scenarios in research and clinical contexts. The Beaver system model, which was developed through extensive research and clinical observations over 2.5 decades, provides a critical framework and tools for understanding and evaluating family dynamics and functionality. The model incorporates Beaver's interactional scales, family competence and style scales, self-report, family inventory. It categorizes families as either inward focused, centripetal, or outward focused, centrifugal. By synthesizing these axes, the model reveals 9 distinct family groups, delineating between functional and problematic ones that require clinical intervention. The McMaster family model, stemming from 15 years of research at Brown University and Butler Hospital, provides a robust assessment framework focusing on whole system family functioning by evaluating its structure, organization, and transactional pattern. The model employs two main assessment instruments, the McMaster Clinical Rating Scale and the McMaster Family Assessment Device, FAD, version 3, exploring 7 dimensions of family functioning: problem solving, communication, roles, affective responsiveness, affective involvement, behavior control, and overall functioning. It assesses problem-solving capabilities of a family, the effectiveness of communication, role assignments, emotional responsiveness and involvement, and behavior control in 3 different areas. It additionally addresses general family functioning. The Moose Family Environment Scale, FEC, is a self-report measure that assesses dynamic functionalities of family environments. It explores key dimensions, including relationship, personal growth, and system maintenance, and provides a comprehensive lens through which family operations, expressed feelings, and personal growth, encouragement, and organizational structures are observed and evaluated. The measure is widely used in both clinical and practice and research. However, a number of psychometric studies were unable to provide evidence that would support its reliability and validity. The Family Assessment Measure 3, FAM3, explores family dynamics across 7 dimensions that include affective involvement, control, task accomplishment, role performance, communication, affective expression, and values and norms. Each dimension is measured at 3 levels. The entire family system, dyadic relationships, and individual functioning. FAM3 gives an opportunity to perform a detailed, multifaceted analysis of family dynamics, allowing a thorough exploration through its 50-item general scales, 42-item dyadic relationship scales, 42-item self-rating scales, and a brief 14-item version of the FAM3. The instrument has solid reliability and validity and has been effectively used across different cultures. There are many other tools that can be used to assess family functioning. Society of Pediatric Psychology of the American Psychological Association has a list of measures to assess family functioning. The DSM-5 TRO ICD and ICD-10 CM also pay attention to aspects of family functioning. DSM-5 sheds light on various relational problems such as parent-child relational issues and sibling relational problems, which can potentially influence the trajectory of mental disorders. The ICD-10 provides specific Z codes that detail various family-related problems and circumstances. This offers an opportunity for practitioners to explore the psychosocial and interpersonal adversities clients might face within their families. Both systems include diagnostic codes, such as those related to child maltreatment or parent-child problems, showing how past and present familial contexts like abuse or neglect can significantly bear upon the diagnosis and treatment of mental disorders. Family assessment is multifaceted. It entails various approaches beyond standardized measures and DSM diagnosis to make sense of the complex family dynamics. Techniques such as interviewing, where social workers not only converse but observe interactional nuances with within the family system can be used, as well as family task observations where families engage in structured tasks, which would enable them to enable social workers an in-depth exploration of family functioning. In addition to that, graphic measures like genograms help visualize family patterns and histories, providing a broader intergenerational context to existing dynamics. Assessing family strengths and resilience is crucial too. 4 components of such assessment are particularly important. They are engagement, exploration, expansion, and evolution.